Hi, I'm Dr. Sata with Insight Functional Health, and I just wanted to take a few minutes to tell you about our practice. I actually got into functional medicine after working in critical care and traditional medicine for about 8 years. And I had started with conventional medical training in general surgery, then moved to the ICU and practiced all through the pandemic. And in all of the training I got, we focused a lot on pathology and what was wrong with the patient, what diseases did they have, what procedures did they need, what prescriptions did they need, but we never really focused on what were the aspects that lead to wellness. And that's just not a typical part of the conventional medical approach. And the more I was exposed to end stage organ failure in the hospital, the more I realized that we really should be looking further upstream. And that's really what functional medicine does. And so, if you look at this diagram, there are a lot of different aspects to health. And clearly, everyone needs to have a good amount of nutrition. You need to have that in order to have the building blocks and the vitamins to create the tissues and have the chemical reactions in your body happen the way they're supposed to. You need to be able to manage stress. And that's not just emotional stress, but it can be stress from infections, from toxins, from lack of sleep, from any number of things. And we really don't address this in conventional practice, at least not in any kind of formal way. We also look at detoxification. And this isn't really about a 7-day cleanse. It's more about the overlying function of your kidneys and your liver, which help clear toxins out, your elimination systems like your gut and regular bowel movements, so that your body's getting rid of the waste products it needs to. And it's getting rid of whatever you may be exposed to in your everyday life. And every one of these factors is necessary to have good underlying health. And I think it makes more sense to focus on these factors than to just focus on the disease that develops when some of these factors have gone awry. And so the kinds of things that we treat here, it's really a broad range. I do have an interest in long COVID, and that partially stemmed from my work in the hospital. I was in the ICU during the pandemic, and so I saw a lot of really sick patients on the ventilators. But I also had colleagues who ended up with long COVID because they got infected early on before we really even understood what that was. So I've been thinking about that, but that's by no means the only thing we focus on. Certainly, chronic fatigue and healthy aging, autoimmune diseases, brain fog, adrenal dysfunction. There's a long list of things that we can work on. And one of the benefits of the functional medicine approach is that it is so comprehensive that I think it can be helpful for patients with a really broad range of conditions. If you did happen to have long COVID and you go to our website, there are some videos that I've done that address that in particular, but that's by no means all we do. So, what would it look like if you were to work with us? Well, first, we typically start out with a fairly detailed review of your history because everyone's course is different. And I think it's important to understand what the underlying aspects of your life were that led up to the clinical and medical condition that you're in today. So, this starts with a 90-minute visit. And from that, from the information we gather, then we make recommendations about any particular testing that may be helpful for you, and any potential supplement recommendations that we might have just based on your history. A lot of those would come later once we had more objective data from some labs. We also talk about group education because a lot of the underlying factors for health that patients are working on are factors that are common amongst a lot of patients. And so this allows us to go into a really deep dive in more detail than we could do on one-on-one sessions. It also lets the patients interact with each other because having chronic disease can be pretty isolating socially if you don't have other family or friends who have similar conditions. And this tries to help bridge that gap. We also have health coaching, and that's to try to provide the support and framework and accountability that you need to help implement the changes that we're talking. And then we meet regularly to go through how your body responded to what we had done so far, what worked and what didn't, and what do we need to change. And if you're interested, if that sounds like an approach that you would like to do, you're welcome to schedule a call. You can go to the website or click on the button here. If you are more curious about how did I end up into this, then you can read about that as well. And thanks so much for listening. Talk to you soon.